My legs are paining, my back is hurting, I can't walk. Nighttime, I have all these tingling sensations in my feet. Oh my God, my life is over. All these kind of feelings, lots of depression along with that. And of course, no family time because the pain is that bad. What are we talking about? We'll check with Dr. Ambika Nair, co-founder and chief consultant with Santhigram Group of Companies. In the program Aware and Care, we've been bringing you a series of programs where we're talking about remedies from home and of course, where major consultation and treatment is required. From Ayurveda perspective, Dr. Ambika Nair gives us lots of solutions. And thankfully, their clinics are located here in the tri-state and also consultation available across the globe. They also have branches in many other countries. Now, let's first welcome Dr. Ambika Nair. Namaskaram, Doctor. Welcome to Aware and Care.
Namaskaram. How are you, Madhavi?
I'm doing good, Dr. Nair. Thank you so much for asking. And I already started the program with all the symptoms and pains and aches and also a little bit of depression with that pain. Well, that is a very popular question from our viewers. In the 75, 80 episodes that we have done, we have our viewers giving us lots of suggestions, lots of inputs, and especially lots of health conditions that they are facing. And this seems to be like sciatica pain. Is that how we call that?
Sciatica.
Yeah, okay.
It's a very painful condition, actually. Because it will be radiating from the lower back. It radiates to the thighs. Some days only it will stay, it will be like just till the knee it comes. Okay, but in certain cases it radiates down also till the foot with the severe pain, and people will not be able to move because without back we cannot even walk.
True.
So it will be very difficult for them. The pain is so excruciating pain. They cannot even do anything. They cannot stand actually. So they will be like walking like a vulture in different, like every position.
Wobbling and like...
wobbling and walking. It very difficult actually.
But Dr. Nair,
this is associated with the lower backache also.
Lower back, okay. Yeah. So they say hip, back, herniated thighs also.
Herniated, that is the causes actually.
That is the cause also.
Yeah,
so this is one of the most misunderstood or self-diagnosed condition, I feel, because I may be very generalized and throwing a number out there. 75 to 80% of the people always talk about leg pain, feet pain, thigh pain, hip pain, and back pain. And this is sciatica nerve pain is something that people just throw it out loosely without even getting diagnosed. Oh, I think I have. But I think this needs a proper diagnosis also, Dr. Nair.
Yeah, because actually it has, like when they come, we have to see that what type of sciatica it is, whether it is related with Vata, whether it is related with the Kapha. Some, Vata will be there, Kapha and Vata will be there because it is always like that. So you can see this, in causes we can see whether any herniated disc is there, where the disc compresses. It, then that's where the pain radiates. And a lot of, sitting jobs are now, especially in the pandemic, people are sitting at home for long hours. So not moving, not traveling, no exercise. And, in that cases, we can see that, so much of cases comes to us. Not only back pain, the way you told, because it has to be diagnosed properly. Until unless it is, radiating till the, to the legs, because it is not called sciatica.
Okay.
Otherwise, it will become like a chronic lumbar pain or something like that. Yeah. With the herniated disc, mostly it is there. Degenerative diseases are there. Even in diabetes, you can see, like anything with the chronic things, we can see that.
And what about growth spurs or bone spurs? Which
spurs are there because that is degenerative, because
degenerative.
So it will be like, compressing over there. That bony area will be compressing this nerve.
Yeah. And what age group do you often see this pain coming?
Normally, it is seen within, like 30, 35 till 50 years and all. But it is very common in ladies and gents, whether anybody can get it actually. See, some days, we do gardening. We don't bother the posture and all. Standing there for a long time and, after this, I will get up and I'll go because little laziness, you understand? No? Okay. And kicking the things sometimes. Very heavy things. So this also, the trauma also can, happen because of that.
Dr. Nair, sometimes I wonder that as we are growing, we feel that our bones are getting stronger, especially when you're a child. But sometimes I feel that as we are growing, our bones are getting weaker. So we have to have a balance of that after a certain age and understand that certain things that we did at 16, 17 or early 20s, we cannot do as we cross 30s, 40s and 50s. And age is a very important aspect of life, and most of the health conditions start creeping up as we start aging. Dr. Nair, there is a lot of misconception about sciatica pain. People have lots of home remedies, DIYs, oh, I did this, I did that, put this balm, put that balm. Like we just discussed, diagnosis is a very important form. And you also mentioned about body types. Now, let's try to understand, is there any specific health condition like like you just also mentioned diabetes, maybe an accident or any specific injury which would
fall or injury, understand now? Any, like even some people, like they do a lot of purgation, like enema and all. Okay, so that improper practice of that, and the suppression of urine. People will be very lazy to go and pass urine, like even the constipation. If no constipation, like even we are, not going in the proper time. This is all suppression. Okay,
wow.
Even heavy weightlifting people, you can see. Some people will go for like a long walk also very fast walk. And like in sitting positions, you can see that they won't sit in proper position, especially with the computers and all. So all positions also make a lot of changes. And excessive intake of like very dry, light and very cold food, consumption of that, then pungent, very bitter, astringent, so much of like, means anything in excess, this all creates all those things,
Doctor, this was a real boom moment for me, because you just mentioned something like constipation and bladder control problems also can lead to this condition.
Definitely.
It's very enlightening to right now know about it. That is the reason. Do you feel sometimes that, or maybe I should understand, that UTI patients also complain to a lot of back pain?
That is backache, but only backache will be there, but not like sciatica. Sciatica will not be. Okay. But they will complain of pain, especially in the UTI and all. They will have pain, the thigh area and even on the, but no tingling will be there.
Okay.
In this condition, like so much of like, see, it is like we always make fun, like Indian electricity. As it compresses, it comes like this, then it sometimes it's very difficult.
Like electric shocks or something?
Too much like electric shocks only. Not only that, they cannot even, lie down. Some people are good with lying down because of that positions, Some, like in certain cases, only one leg will be there. That left side of sciatica is very common. I have seen that. Okay, even only one side. But people with both the sides, it's a really, like a depressive disease.
Okay. And how long does this pain start? What is the frequency for people? Is it continuous for some, or is it just it comes in phases?
See, like one time they will tell that I was lifting my son, I was lifting my child, then suddenly it happened because the position is not right in this condition. Like suddenly he had a very like the severe pain, acute pain, and he was hospitalized. They will be giving some painkillers on steroids and all those things. But if like if we don't take care at that time, if like whatever the doctors say, again if it is repeating, then it is going to have a very hard time for these people.
Wow, today's
repetitive, like we get like oh, I had from the age of like 2022 in the college, because the sports also they fall a lot. Okay, so these cases I have seen that.
So this is a wholesome condition where it can come at any point of time. Small little accidents to little wrong positions, anything can lead to that. Dr. Nair, I've often heard women talking about more on the sole. The pain is more under the feet. The pain is a little more.
That burning sensation will be there.
That is what it is called. Okay.
Yeah, burning sensation will be there. But like sometimes rarely the stiffness may not be there, but only like a pricking sensation in those parts. Okay. Altered gait, they cannot walk in the proper way. Like a sacral region, like a popliteal, like a back, okay, calf muscles and foot, very difficult. Some days, like it will be a little better, but the calf muscles become very heavy for them. They cannot even lift it because swelling also, inflammation will be there. Severe inflammation will be there.
Okay. So let's try to understand how the treatment process is at Santhigram, because this is a condition I'm sure most of our viewers are looking with a lot of curiosity. Please tell us some home remedies they will be saying, but let's start to understand how this is diagnosed, what treatment options are available at Santhigram.
Really, it is a good question. First of all, diagnosis is more important. Okay, we had to observe the patient, we had to ask certain things, we had to do the Nadi Pariksha. Nadi Pariksha, we understand what it is.
Yes.
Okay, but still, since the history has to be taken in the proper way, what was the causative thing, factor, how it happened to them. Then tongue diagnosis is more important. We have to see whether any indigestion is there, appearance of the patient, whether it is kapha or like a kapha vata, or because the vata is the root cause of these things. Okay, pain. Pain is always vata, whether it is related with this posture or anything like that. Whether it is like any disc prolapse is there, like whatever the condition we had to see. Then, like normally that oleation will be given, like Abhyanga, which will improve the circulation. Special oils are used in this condition. According to the case, we always go with the medication. Okay,
Right.
so then, like a Kadi Basti, we make a bund at the back, we'll be pouring special oil over there. See, not only sometimes, but in between the buttocks also, they cannot sit for a long time. Some people will tell that we can just, like when we get a doctor, after walking little bit, we feel little comfortable. So, like the special pijus are administered over there in the positions. Then yoga vasti is given according to the constitution, whether they have any other, like any other, as hyperacidity is very common in these things, aggravation of vata. So we'll be giving them, yoga vasti. Like medicines will all differ from person to person, actually.
Okay.
Yeah. Then like steam bath, diet has to be given, but they all, like after 5-6 days, they are much better. Normally, some people will be like very fast. Some people take little more time. But 3 weeks, and then, we always tell them how to go. Pidichili is given. So many treatments are there.
Okay.
And even, like according to the constitution, we change the treatment also. But pain will be much better within like 3 days maximum.
Wow. So friends and viewers who have been bombarding me with messages and texts talking about, please find a solution for this. I do not have solution. I will only guide you towards the solution and possible remedies, which you have to follow when you reach out to Santhigram group of companies, and they are a facility here also in the tri-state. Dr. Nair, any home remedies and suggestions that you can give so that it can comfort them temporarily and so that they can reach to the doctor after that?
Yeah.
What kind of foods?
Yeah, home remedies, like a castor oil is very good.
Applying or eating?
No, taking castor oil. So it helps a lot, actually. Even turmeric, it helps a lot. Inflammation, it reduces. But we have to see, whether it is the vata kapha, like some people have very big of like drowsiness will be there, indigestion will be there, nausea, they will not feel like eating, like anorexia will be there. Heaviness in the legs, like a freezing sensation. Doctor, I cannot walk, like in the.
So they cannot take castor oil then?
Yeah, no, they can take, but castor oil is very good for everybody.
Okay.
Yeah. So it all depends, how to go with that, actually. Yeah.
So friends, when certain home remedies are given, it is a very generalized home remedy. It is not individual and specific based. Like in Ayurveda, Dr. Nair has been very consistent in conveying this message to our viewers. There is a body type when certain home remedies are also prescribed. These are only temporary solutions. Please do not take it as a long term and say there's no solution to it. We have been mentioning this in every episode of Aware and Care. Please do not try the home remedies just like that. Have a basic consultation first. Dr. Nair, when somebody comes to Santhigram and they're talking about all these things, they're talking also about the programs that they're watching. What is the general feel after that? The treatment happens 3 days, 4 days, especially let's also talk specifically about this
They
program.
will be referring their friends and their relatives everywhere, even from outstation in. And say sell price is not good, but I'm telling, but whatever we are doing, everybody is happy with us.
Yes, absolutely. And these little capsule programs that we are conveying to our viewers, that these solutions and certain, easy methods of getting yourself treated are possible. And we are so fortunate today that Ayurveda is available in the United States. A flight from California to New Jersey, a drive from Virginia to New Jersey is not very difficult, especially considering the difficulties and pains that you have been going through, and you've tried everything. And of course, Dr. Ambika Nair follows all protocols required by the system, and it has been taken care of. Dr. Nair, just before we part with this particular series, people always assume that walking helps for this pain. Does it? Does it not?
No, it all depends upon the case actually. Because some days, only like a brisk walking a lot, like a long hours, very fast walking only will cause. See, first of all, you have to see that, whatever you eat, it should digest actually. So easy digestible things only people should eat. So when you have a bloated abdomen, it all affects the back actually. Yeah, like forward bending. We have to bend on our knees actually. So little bit of like a preventive therapy, if they take care, then things will not aggravate. Not only that repetitive, oh, I had a backache, like this, because I had a case recently. He did the treatment perfectly all right. It was a very chronic, like a 28-year-old, this sciatica problem. Perfectly he was all right. But when it was snowing, what he did, he played with his child.
Oh.
See, in the cold weather, like, so he had a little shooting pain. He came here, but we did not did the therapy. But with the herbal supplement, I could manage him. See, this is what, like playing and all okay, but, like lifting and throwing everything, so he forgot that he had a backache.
Oh. Emotions play a very important role in your treatment, and of course you have to follow certain steps for this entire treatment. Doctor just mentioned about in the winter, well, spring is coming. Doctor also mentioned about gardening. We forget in that excitement there are certain ways and positions to sit and work. So all those consultations are possible at Santhigram Group of Companies, keeping the capsules as short as possible. To give information to our viewers, we want to thank Dr. Ambika Nair for her patience and time. And viewers, I definitely must give a testimony here that every time I meet Dr. Nair, it has rarely been a situation where I had to tell her that I'm having a particular discomfort. She looks at the face and she tells you most of the time. So as convenient and easy it is to consult the group of companies and your local clinics nearby. Thank you so much, Dr. Nair, for today's episode. Please like, share, and subscribe, dear viewers, to the episode so that you're the first person to know about what possible remedies and options are available at Santhigram. Thank you, Dr. Nair.
Thank you so much.